So, Dr. Manohar tried to defend that micronutrient is much needed. In this hall, how many of you think that food is also important and supplementation is also important? Rise up hand. Over? My job is done. Sir, shall I have food now? Initially, when Dr. JVK gave me this talk, this balanced view, I said, I thought, okay, I'll come and talk like that. Then he said, you need to prepare a slides. I said, what slides? Once again, balanced view is easy. See, the audience only already given the balanced view. So, anyway, so I'll give my balanced view here. Greetings to all of you from Bangalore. We just heard diet is enough, and also diet is not enough. Welcome to medicine, where both are right. So my job today is simple, confuse you scientifically. So after listening to both sides, I agree with both. One says diet is sufficient, one says it's not. And my patient says, doctor, I eat everything except what you told. So clearly, the truth is somewhere in between. So A1C gets the spotlight, micronutrients still run the backstage metabolism. Textbook versus WhatsApp University. Nowadays, WhatsApp University, so much is there. So in textbook, balanced diet gives all micronutrients. In real life, skipped meals, weekend binge, Google certified nutrition. Diet is perfect only on the PowerPoint slides. So are diet-based micronutrients enough? Do we need supplement? Or is the answer somewhere in between? That is the balanced view. So three positions: sufficient, most needs can be met from nutrient-dense diet. Not sufficient, modern diets, disease and drugs make food alone unreliable. Balanced one, start with food, then add fortification, look for the labs, and targeted supplements when risk says no. Only one clinical answer, choose the best one. So micronutrients are actually the intro words of diabetes care. In this article in Nature, incident type 2 diabetes attributed to suboptimal diet in 184 countries. What it says, food quality matters, but population also has hidden risk for micronutrient gaps. The real question is not food or supplements, it is when food is enough and when it is not. 70.3% type 2 diabetes are having suboptimal diet. You can see in this slide diabetes burden attributable to suboptimal diet. See, you can suboptimal diet, so many things are there. Leads to diabetes burden. That's why Dr. Mohan is speaking on next topic on precision type 2 diabetes. I'm sure he'll address the diet pattern as well. And food is the foundation. Food pattern, on the left hand side you can see, build around vegetables, legumes, whole grains, nuts, seeds, lean proteins, eggs, dairy or equivalent choices. Foods brings the micronutrient with fiber, protein, fat structure and satiety. In the middle you can see fortified food and substitution. Useful when a nutrient is hard to obtain consistently from the usual intake. Think fortified cereal, dietary alternative or plant dietary swap. Improve but not fully recover. On the right hand side you can see labs plus targeted supplements used when risk factors, symptoms, life stage, medication or the lab data say food alone may not be enough. Supplements do not recreate micronutrients. If you say eat spinach, cure everything, we always say to the patient eat healthy. Patient thinks the doctor has told eat healthy, I will throw away the insulin. So this is the situation. So we should be very, very careful in our advice. This article from this month, American Journal of Clinical Nutrition, addressing micronutrient requirements in type 2 diabetes, an international consensus report. This calls for a more nuanced approach to nutrition therapy for patients with diabetes, emphasizing the importance of further research to develop tailored micronutrient management strategies that address their unique needs and improve health outcomes. So high prevalence of deficiencies, on the red you can see, diabetes alters metabolism, diet alone may not meet the needs. So you can see if supplements work, everyone taking multivitamins, then there should not be no diabetes. But reality, it's not happening. So the American Journal of Clinical Nutrition addressing micronutrient requirements in type 2 diabetes and international consensus report. The ADA advises against the routine use of multivitamins or mineral supplements for individuals with diabetes or prediabetes in the absence of a documented deficiency, as current evidence does not support their benefits for glycemic control. So no benefit in glycemic control, routine supplementation is not recommended. This is this month article. So food sources worth defending in diabetic clinic. So this is very important. You can see on the left hand side B12, magnesium, folate, vitamin D plus iodine. So how the things are there, how the patients are deficient. The reality check is the world is not eating a textbook diet. I'm sure we can see in this slide. These estimates are from foods alone. Fortification and supplementations were excluded. Women had higher inadequacy for iodine, B12, iron and selenium. In type 2 diabetes, the gap gets harder to ignore. You can see micronutrient deficiency is 45%, vitamin D 60%, magnesium deficiency 41.9%, B12 deficiency in metformin group is 28.72%. Not every deficiency is caused by diabetes itself, but diabetic clinics are where these gaps show up. I am sure all of you will agree on this. Good glucose plus bad micronutrients is still incomplete care. So what are the clinical evidence? You can see in the first article, the burden of micronutrient deficiency among patients with type 2 diabetes, systematic review and meta-analysis. So you can see in the red column, the deficiency leads to neuropathy, common in diabetes, needs monitoring. The second article that tracks links between micronutrients and type 2 diabetes risk, the singular role of selenium. Antioxidant role is always questioned, excess is also dangerous, decrease is also not good. This is the practical problem. Another article, dietary advice for individual with diabetes, theoretical benefits of antioxidants, that is ALA, vitamin C and E is there, but there is no strong RCT evidence. The association between micronutrient levels and diabetic foot ulcers, a systematic review with meta-analysis. This article says that low micronutrients leads to DFU, neuropathy. So personalized supplementation are needed. You can see the variety of results in these studies published. So the great weight loss can still hide poor micronutrient intake. So tiny intake on the left hand side, you can see starting from the left hand side, tiny intake, intentional weight loss can improve A1C while quietly shrinking nutrient exposure. Narrow food rules, very repetitive plans may hit macros but miss the breath. Older age and low appetite, frailty, GI symptoms or low appetite reduce reserve. High risk patients like vegan diet patterns, pregnancy, CKD or long-term metformin should raise suspicion. ADA 2026 added counseling and regular monitoring for adequate nutrition intake during intentional weight loss. So what is the clinical approach? First one, screen the high risk group. Look for monitor B12 and vitamin D. And most important is the avoid over supplementation. Not all need supplements, not all rely on diet. It's always the individual approach. So balanced view from my side is the core message. So key principle, food first, supplements if needed. Assess deficiency, then treat. Google says take 10 supplement. Doctor says take 1. Patient takes anyway 5. My son is in America, my son is in England. They have sent me the bottle of big tablet capsule. Sir, can I take? What do you say? This is a practical problem. They bring with the big bottles also. Some calcium, some vitamin, fish oil, something into that. You tell all these things. We take only one is enough. But still, my son has sent me with affection. I'll take all. So this is a practical problem. So deficiency leads to harmful. Excess also leads to harmful. So balance is the evidence based. Not every diabetic needs supplements, but ignoring micronutrients is equally dangerous. Not food versus supplements, but the right use of both for the right patient. That is the mantra. Ajay Tiwari has told the beautiful mantra that was 50 years back. Mano tried to defend the present scenario where that mantra trying to hold good because of the various issues. My mantra is the balanced view. So Google versus doctor. Google says take vitamin XYZ. Grandma says eat proper food. Bacche, mera bacche, eat proper food. But our bacche don't eat proper food. They eat pizza, burger and all those things. So balanced approach is both wisdom and science. Ladies and gentlemen, this is not a fight. It's a partnership. Diet is the foundation. Micronutrients equals maintenance. Supplements equals repair kit. You don't build a house with only paint or only cement. We know that. So the combination is very important. Manor has shown many Durandar slide. So here comes the another Durandar slide. Diet is essential, but not always sufficient. The video comes here. Not always sufficient. Deficiencies are real, even in healthy eaters. Not every patient needs supplement, but some definitely do. One size fits all nutrition doesn't work in real life. Test when needed. Don't guess. Don't blindly prescribe. Right patient, right deficiency, right intervention. Balanced view is not compromise. It's the clinical intelligence. This is the real Durandar of the balanced view. Thank you, ladies and gentlemen.